Does your knee wake you up before your alarm? Do your hips complain every time you stand up? Do the stairs in your own house feel like a small mountain now? If you're over 60 and living with joint pain, especially from osteoarthritis, you've probably been told some version of, just rest. Don't overdo it. Your joints are worn out. Be careful. The problem is, if rest is your only strategy, your joints usually get stiffer, your muscles get weaker, and simple movements start to feel harder and more painful. Today, I want to walk you through 5 simple movements that usually hurt less but help more. Gentle, joint-friendly exercises that respect your pain, keep you within a safe range, and slowly give you more freedom back. Before we do that, I need to say this clearly. Everything in this video is for information and education only. I'm not examining you. I don't know your full medical history. If you have severe pain, big swelling, recent injury, fever, redness, or sudden changes, you should see your own doctor or physiotherapist before trying any of this. This is not a replacement for medical care. It's a guide to help you ask better questions and move more safely. Let's start with what's actually happening inside those painful joints. What osteoarthritis really is. A lot of people imagine osteoarthritis, like bone rubbing on bone, as if the joint is just grinding itself to dust. That image is scary and not very helpful. Osteoarthritis is more like a slow remodeling project gone wrong. Inside a healthy joint, you have cartilage, smooth tissue that covers the ends of bones, helping them glide. Synovial fluid, a natural lubricant that nourishes the cartilage and reduces friction. Bone, ligaments, muscles, and tendons working together to move and support you. With osteoarthritis over time, the cartilage becomes thinner and rougher. The joint lining can become a bit inflamed. The bone under the cartilage can change shape. The joint may form bony spurs, and the capsule can feel tight. You feel this as pain, stiffness, and loss of movement, especially after rest or in the morning. Here's the important part. Yes, the joint has changed. No, it's not ruined beyond hope. And movement done the right way is one of the most powerful tools we have to reduce pain and improve function. Think of it like this. Motion is lotion for an arthritic joint, as long as the motion is gentle and smart. The wrong movement at the wrong angle with too much load can flare your pain. But the right movement in the right range can bring more nourishment to the joint, keep the surrounding muscles strong, and actually reduce your pain over time. So your goal is not no pain ever. Your goal is better function with tolerable pain and fewer flare-ups. Let's talk about how to keep things safe. Safe discomfort versus dangerous pain. Before we get to the 5 movements, I want to teach you a simple pain rule many physios use. Imagine a pain scale from 0 to 10 o'clock equals no pain at all. 10 equals the worst pain you can imagine. When you do gentle movement with osteoarthritis, a pain up to about 3 or 4 out of 10 while you move can be acceptable if it settles back to your usual level within about 24 hours. If your pain shoots up to 7, 8, 9 out of 10, or if a small increase in pain stays much worse the next day, that movement was too much, too fast, or not right for you. So as we go through these exercises, listen to your body. Mild discomfort, tightness, a bit of rusty feeling, often okay. Sharp, stabbing, catching, locking, or a major swelling afterwards. That's a stop sign. Now let's go through the 5 movements that usually hurt less but help more. We'll focus on knees, hips, ankles, and shoulders because those are common trouble spots after 60. Have a sturdy chair or countertop nearby for support. Movement 1, the oil can glide for stiff knees. This one is for those mornings when your knees feel like they've rusted overnight. Starting position, sit on a sturdy chair. Feet flat on the floor, hip width apart. Sit tall, shoulders relaxed. Step 1, gentle bend. Slide your right foot back under the chair as far as you comfortably can. You'll feel a stretch in the front of the knee or thigh. Hold for 3 to 5 seconds, breathing normally. Step 2, gentle straighten. Then slowly slide the same foot forward and gently straighten the knee, lifting the heel a little if you can. Don't force it into a locked position, just a comfortable straightening. Hold again for 3 to 5 seconds. Move back and forth between bending and straightening like you're slowly oiling a hinge. Do this 8 to 10 times for the right leg, then 8 to 10 times for the left. Why this helps? You're moving the knee joint through a safe range of motion without putting your full body weight on it. You're helping the joint fluid circulate, which can ease stiffness. You're gently activating the muscles around the knee. If pain stays mild and doesn't flare later, this is a movement you can use every morning and after long periods of sitting. Welcome to our guide on gentle exercises for arthritis, designed specifically for individuals experiencing joint pain or osteoarthritis. Today, we'll focus on movements that strengthen without causing deep bends, starting with the assisted sit-to-stand for hips and knees. Getting out of a chair is a crucial daily movement. Practicing it correctly can build strength without crushing your joints. Begin by choosing a chair with arms or placing it in front of a sturdy table or counter for support. Sit near the front edge of the chair with your feet flat, slightly behind your knees if possible. To stand, lean your torso slightly forward, bringing your nose over your toes, then press your feet into the floor. Use your hands on the chair arms or thighs to help push yourself up, standing to a tall, comfortable position. To sit down, reach back for the chair if needed, bend at your hips and knees, and lower yourself slowly, controlling the descent. Start with 5 repetitions, rest, and observe how your joints feel over the next 24 hours. If it goes well, aim for 2 sets of 5, gradually building to 2 sets of 8 to 10 over several weeks. To reduce pain, use a higher chair or a firm cushion, as a higher seat means less knee and hip bend. Keep your feet slightly wider apart if you have hip arthritis, and always move slowly, as rushing can worsen pain. This exercise strengthens your thighs, hips, and glutes, which are critical for walking, stairs, and balance. Stronger muscles around an arthritic joint often lead to less pain in everyday life. Next, we introduce the countertop hip hinge, an alternative to deep squats that loads the hips without stressing the knees. This movement shifts work to the hips and glutes, which tolerate load better, keeping your knees at a gentler angle. Stand facing a kitchen counter or sturdy table, placing both hands lightly on the edge, with feet about hip width apart. Soften your knees with just a slight bend, not a full squat, and keep your back long, avoiding any rounding. Slowly push your hips backward as if closing a drawer with your backside, allowing your torso to lean forward slightly. You should feel the work in the back of your thighs and buttocks, not sharp pain in your knees. Go only as far as comfortable, then push through your heels to gently bring your hips back to the starting position. Perform this 8 to 10 times, rest, and repeat if you tolerate it well. Imagine you're a hinge at the hips, not bending at the back. If your knees hurt, reduce how far you bend. If your back hurts, you may be rounding. Try to keep your chest gently lifted. This exercise trains your posterior chain, crucial for standing, walking, and climbing stairs, while using a pain-friendly range at the knees. It can also reduce the load on the front of the knee, where many people with osteoarthritis feel their pain. Movement 3 is the ankle pump and circle, designed to help circulation and joint fluid in swollen, stiff feet. Gentle ankle movement can alleviate stiffness, improve circulation, and enhance comfort in the lower legs, especially if you sit a lot. For ankle pumps, point your toes away like pressing a car pedal, then pull them back towards your nose. Move slowly through a comfortable range, doing 15 to 20 repetitions on each leg. For ankle circles, lift one foot slightly and draw slow circles in the air with your toes, 5 to 10 in each direction. Repeat on the other side, keeping circles smaller if an ankle is very stiff or painful. These movements promote blood flow, keep the ankle joint moving for balance and walking, and reduce that heavy feeling. However, if you experience significant swelling, redness, heat, or sudden changes in one leg, consult your doctor immediately. Finally, we have the most underrated joint medicine, the comfort-paced 5-minute walk. Many with osteoarthritis fear walking, thinking it will wear out their knees or cause pain. But carefully paced, consistent walking can lubricate your joints, strengthen muscles, improve balance, and help with weight management. It also significantly improves mood and sleep, making it a holistic approach to managing arthritis. The key is to find a dose and a pace your joints can tolerate, starting cautiously if you've been inactive. Remember, these gentle exercises are designed to empower you to move more comfortably and confidently. Managing joint pain after 60 doesn't mean stopping movement. It means moving differently, more thoughtfully, and gently. First, choose a safe route for your gentle movements, whether indoors along a hallway or around your home. Alternatively, you can walk outdoors on a flat, even surface, but avoid uneven ground, steep hills, or slippery paths at first. Next, focus on time, not distance. Set a timer for 5 minutes and walk at a comfortable pace where you can still talk easily. If you need support, use a cane or walking poles, or walk with a companion to ensure stability. During your walk, pay attention to your joints. A mild increase in pain, up to around 3 to 4 out of 10, can be acceptable. However, if you're limping heavily or pain spikes sharply, slow down or shorten your walk immediately. After the walk, notice how your joints feel. If they're a bit looser and pain returns to baseline within a few hours, that's a good sign. If you feel much worse that evening and the next day, start with a shorter time, even 2 to 3 minutes, and build more slowly. Over weeks, you might progress from 5 minutes to 8, 10, or 15, or even do 2 shorter walks instead of 1 longer one. Walking is a whole body movement that keeps your joints from getting rested by long sitting. It supports your heart, brain, and mood, not just your knees and hips, offering comprehensive benefits. These gentle movements are a starting point, not a full program, and your situation may be more complex. Here are specific questions to ask your doctor or physiotherapist at your next appointment. Ask, is my joint pain likely due to osteoarthritis, or could something else be going on, and inquire if you need imaging. Also, ask, are there any movements or activities you want me to avoid right now, such as deep squats or heavy lifting? Inquire, can you refer me to a physiotherapist who works with older adults and arthritis for a tailored program? Ask, what pain relief options are safe for me, including topical creams, tablets, or heat/cold approaches? Finally, ask, how will we know if my arthritis is getting worse, and what can we do early to slow it down? When you show up with these questions, you're not being difficult, you're being engaged and managing your health proactively. Let's recap our 5 hurt less, help more movements: seated knee bends and straightens, oiling the hinge without full body weight. Assisted sit to stand, building strength for daily life with a higher seat and hand support. Countertop hip hinge, training hips and thighs while sparing the front of the knees. Ankle pumps and circles, keeping your feet and ankles loose and your blood flowing. And the comfort-paced 5-minute walk, using the most natural movement you have as medicine. These movements aren't flashy or found on fitness posters, but they're quiet, consistent actions. Done most days, they can mean getting out of a chair without bracing yourself for pain. They can mean going for a walk without fearing every step, and standing at the counter to cook without needing to sit after 3 minutes. Ultimately, these movements help you feel like your body is working with you, not against you. Today, choose just one of these movements to start with, whether it's a morning knee glide or ankle pumps before bed. Do it gently. Stay within that safe pain zone and notice how your joints feel not just during, but later that day and the next morning. Remember, you're not too old to help your joints, and it's not too late to make them feel safer and more reliable. Joint pain after 60 doesn't mean you must stop moving. It means you must move differently, more thoughtfully, and consistently. Every time you choose one of these movements over total rest, you're casting a small vote for your future independence. These small votes, added up over weeks and months, can quietly change the way you walk through your life.